Okay, so officially, the webinar has now started recording. So once again, magandang hapon po sa ating lahat. A hearty afternoon to every one of us here. We are gathered at the virtual lobby of DepEd of Busan del Norte for the conduct of iHeart School Health DepEd Agnor webinar series on health and wellness. Today is August 19, 2020, and today is day 2 of this particular webinar series. So today's featured topic is iHeart School Health, Respitiquette, Respiratory Health Readiness, and Basic COVID Preventive Measures. So to start with our activity, before we press on further, let us first acknowledge the facilitators behind this activity. First up, we have our Schools Division Superintendent, Romeo O. Aprovichar Sasufan. A round of applause na virtual pa. Clap, 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 clap. Okay, moving on forward, we have the Chief Education Supervisor of the SGOD, Ma'am Clarina L. Ciclon. Virtual platform. Then, of course, this wouldn't be possible without the facilitation of our Division Medical Officer, Dr. Eladio V. Angulo III. A round of applause for our beloved Docky. And of course, the Health and Nutrition Section personnel consisting of dentists, nurses, and dental aides. Ayan po yung mga ganitang at maaamong mukha ng ating mga kasamahan sa Health and Nutrition Section. Ang kaagapay nyo sa inyong nutrisyon at hindi ko na alam kung ano yung health sa Tagalog. Okay, moving on further. Before we press on, we have our etiquette for video conferencing etiquette. So, quick recap lang po. Plan ahead to avoid distractions. Think of positions. Make sure that your face can be seen on the screen. And then prepare. As what I said earlier, dapat namin mga notebook o mga nakabutang sa inyong surrounding areas like water, food, hotdog, chicken joy, uguban pa. Mulag nag-movie, popcorn, pwede po. Okay, next we have area of location. Then, eliminate background noise. And unfortunately, as you can observe, may mga slight background noises po kami ngayon. Kasi we are actually here at the lobby of DepEd Paraga Region. Kasi nagpa-frontline kami ngayon. Currently, Himafon. And next with that is consider the lighting. Make sure that the lighting is appropriate. Nga, di shadow ang makita sa inyong face. Then, of course, selective daily view. Again. Okay, so we will now start formally with our activity. Let us first bow down our heads and feel the presence of the Lord as we will have our opening prayer. Okay, let's bow down our heads. In the name of the Father, the Son, and the Holy Spirit. Amen. Lord, thank you for gathering us in this particular webinar activity. We hope that you would continue to enlighten us, give us the insight, the knowledge, and the wisdom to understand all of the topics that will be discussed for today. We hope that you will continue to keep us safe, especially that we are going to serve our different clientele, our learners, our guests, and different stakeholders when we do our job as government officials. Because we ask for Jesus Christ, our Lord. Amen. Okay, on to the next part of the program, which is the attendance recognition. So unlike yesterday, di na ako isa-isa kon, we have already seen kung kinsa ang ato mga respective representatives for the different districts of Busan del Norte. So ako nang i-flash sa screen. So your attendance will be verified later using the attendance and evaluation forms that will be gathered during the end of the session. Okay. And of course, the personalities behind this activity, the Health and Nutrition Section personnel. We have our medical officer, dentists, nurses, and dental aides. So a quick recap po before we proceed further with our first session and second session is the recapitulation. So, unsa man ang atong mga discuss yesterday are the basic guidelines and legal basis for the conduct of the activity. This was discussed by yours truly, Zenon Hernandez, school nurse. One of the topics that was discussed was the conduct of iHeart School Health Webinar Series, which is based on DepEd Order number 14, series of 2020, and Division Memorandum issued to this effect. So there are 3 days allocated for this webinar. So iHeart School Health Webinar Series is will be conducted into 2 parts: division webinar, which is recorded as what we are doing right now, and of course the district cascading, which is the time when the district supervisors or the district level cascading will follow. So during the district cascading, the recorded video will be played for the consumption of the participants like school heads and school designated health coordinators or OKs and coordinators. This will be facilitated by the district supervisor, the district designated health coordinator, or the OKs and coordinator, and will be assisted by the district health personnel of that particular district. Moving on further, the second session of day 1 was minor with COVID matters. This was discussed by Local Antigua and Rosana G. Duran, school nurses, MHNYFC coordinator, and ARHE and ARY coordinator, respectively. So they were able to discuss the different aspects on PFA, MMPSM, and other COVID mental health related matters in regards to the ongoing pandemic. Okay, for day 1 feedback. So of course, we would like to share the feedback or responses that we gathered for the activity we conducted yesterday or during day 1. So all in all, naka-receive niyo 42 responses from all of you. So we are very much thankful for all of the responses that you have given us for the conduct of the activity. So as you can see on the screen, there are 5 highlighted comments for you to see. So mora ni siya, ang amo ng gipili is mora ni siya mga unique and heartwarming comments. Okay, first comment is topics were very timely for this pandemic time. Highly commendable undertaking. So we'd like to express our deepest gratitude for appreciating the efforts of the school health and nutrition section. The next comment is congratulations for sharing your know-how. You shared it explicitly. Maraming salamat po for your comment. Then, of course, let's consider some technical errors and difficulties during webinar, especially internet signals. Yes, I can really relate to that particular issue po. Kasi what I'm experiencing now is I'm not actually in my home. So my internet connection is not very stable. So every now and then baka mawala-wala din ako. So of course, we need to consider some technical errors or difficulties during the webinar. Then, fourth comment, we have outstanding webinar. Oh, maraming salamat po, nakakataba po ng puso yung comment niyo. And ang next, fifth comment natin na i-highlight is, it would be better if all school heads can join. Personnel in health services know better than us in terms of medical matter and can answer satisfactorily. Actually, we considered doing this particular activity because we see the wisdom behind this comment, but unfortunately po, the virtual, the circumstances wherein all the people that are needed to be addressed is dili makasulod sa tanan sa one particular room. Munang siya isa sa mga constraints behind doing your virtual meeting. So we had to consider na efficient siya at the same time quality po pag-conduct sa atong training. Yun, tanggal ko sa business. Okay. So, we would like you to understand that we had a lot of technical considerations as well with regards to conducting this activity. That's why only a chosen few between the districts were called upon to attend this activity. And of course, nangita ko ni way na maka-assist kayo with regards sa mga schools through the recordings. Pwede man na ito i-play kay mag-guided naman ako mga schools with regards to the topics that will be discussed. Okay? So, on to the topic for the day. Moving on forward, we have the first topic that will be discussed is the featured topic for the day. I Heart School Health Respitiquette, Respiratory Health Readiness, and Basic COVID Preventive Measures rather. So this will be discussed by Belle Robles, school nurse under Nursing Services OKB coordinator. So this is very important because what Ma'am Belle will discuss will be actually the one who will be orienting your school personnel and learners inside your school. So, ang protocol na to under DO14 series of 2020 is that during the first conduct of physical meeting nato sa mga personnel o sa ato mga learners, kailangan mag-orienta about respiratory etiquette and COVID preventive measures. That's why we initiate ang School Health and Nutrition section nga mag-conduct ani kay para kabalo ang mga taga-school kung unsa ilang sulti or na sila yung resource materials na nila pag mag-cascade na sila patulong sa ilang more respective classroom. Okay. So the second topic for today will be discussed by yours truly, which is required health standards and health protocols in schools. Ato rin i-rehash and recap kung unsa ang nakakita or unsa ang atong makitaan sa DO14 series of 2020 na basic and standard health protocols in schools. So without further ado, let's start with our first session, which is Respitiquette, Respiratory Health Readiness and Basic COVID Preventive Measures. So I'm yielding the floor to Ma'am Belle Robles, School Nurse, Nursing Services OKD Coordinator. Ma'am Belle, the floor is now yours. You may now present your session.
Yes, Sir Zen. Good afternoon. Wait lang ha. Can you see my slides now? Can you see my slides now?
Not yet, ma'am.
Wala pa.
Wala pa.
Okay, kana.
Wala gyapon.
Wala?
Wala pa, ma'am.
Oh. Yeah. Wait, I will go back. This one. Okay? Kita na? Can you see my slides now?
Wala, ma'am. Wala.
What happened? Okay, wait. Here. I will cancel it. Sorry, I'm sorry for the delay.
So while waiting for the chat box may be used if you have any comments or suggestions or any inputs with regards to the session that will be discussed. You may use the chat box and it will be read later on after the presentation. So feel free to use the chat box.
Okay. Yan. Can you see it now? Nakita na?
Wala gyapon, ma'am.
Oh, what happened? Azur Zen?
Wala pa po, Ma'am Belle.
Oh. Can we proceed na lang to the next? I do not know what is happening to my slides. I can see it here. Pero,
Okay. Suggestion lang ako, Ma'am Belle. Can you send, tapos ako mag-present later on. Tapos, mag-proceed lang po sa ako ang presentation.
sound to Sir Zen.
Kindly send your presentation po sa akin. Tapos, I'll download it and I'll be the one to flash it.
Wait lang ha.
For the meantime po, Ma'am Belle, let's take your suggestion po na mag-una ko.
Okay.
Okay. Sige po. So with that, due to, ayun. Nana, Ma'am. Nana, Ma'am Belle. Ayan, Nana po.
Ay, nako. Ay. Okay.
Okay, once again, Ma'am Belle, para mawala ang kwan.
Okay. So that's a full
Okay.
screen. So you cannot see me.
Yes. Nakakita na.
Kita na?
Yes. Ayun, Belle Robles is presented.
Wala nga, wala.
Wala pa?
Nawala na. Okay, yan.
Guys, can you see the presentation po?
Hindi pa.
Ha?
Wala pa, sir.
Wala pa?
Wala lagi.
Mm-hmm.
Marag nagitay technical difficulties.
loading.
What's happening?
Pagka na lang, Ma'am Belle, mag-send na lang. Ako na lang i-present later.
Okay, Sir Zen. Okay.
Okay. Ayun. So with that, due to technical difficulties, we will be presenting the first session later. So mag-una ko si Belle. So the second session is called the DepEd Report, Health Standards According to DepEd Order Number 13, Series of 2020. It will be discussed by yours truly, Zenon Hernandez, the OKD WINS Division Coordinator. So maraming salamat po sa understanding because na po sa new normal, dagan ito yung mga technical difficulties and glitches. So we thank you for your understanding in this regard. So moving on further with our activity, I will now start with my session po. So the required health standards was presented to us by DepEd Order Number 13, Series of 2020. It shall be adopted to DepEd, Central Office, Regional Office, and SDOs, and all public and private elementary and secondary schools. So primarily, the basic health standards released by DepEd was based by the DOH standard, which is DOH Administrative Order Number 2020-0015, which is the guidelines on risk-based public health standards of COVID-19 mitigation. So with regards to the mitigation objectives, we follow and the DOH follows the four principles behind it, which is increase physical and mental resilience, maunang ga-augmenta sa atong lawas, augmenta with our mental health principles as well. So next is reduce transmission, mauna siyang nag-adapta with our alternative work arrangements na to that was being initiated by our civil service commission. And then of course, nakalimutan ko yung following yung camera. Yan. And then reduce contact, same principle po, why nag-implement po ang atong different government agencies with alternative work arrangements. It's because as much as possible we have our reduced contact. And then reduce duration of infection atong last mitigation objectives. With that, specific measures or interventions are being utilized to schools and offices. So with that particular DepEd order that is being invoked for this particular activity, we have the enclosure as you can see sa atong mga screens. The first enclosure includes the measures for the schools, and the third enclosure is measures for the offices. So for the schools, mo na siya i-follow sa schools, and for the offices, mo nang i-follow sa division office and sa district offices. Na may feedback po kasi na hindi clear yung audio. Can you hear me? Okay. Sorry po. Can you hear me po?
Ayun. Tanggalin ko muna yung mask ko. Hello. Is it clear now?
Clear.
Okay.
Okay, klaro na.
Okay. Okay, so moving on forward, as what I said, this DepEd Order number 14 contains a number of enclosures. So as you can see on the screen, enclosure number 2 pertains to the schools nga implement nato ng mga measures galing sa atong central office. And the third enclosure contains the measures that will be implemented on our offices, which pertains to the division office or the district offices under the particular SDO. So first up, routines and protocols for health and safety, physical arrangement in school. It is also in that particular enclosure. Then support mechanisms and screening of returning personnel and learners and testing protocols. Same principle po, routines and protocols, physical arrangement in offices, then support systems, then screening of returning personnel and testing protocols. So atong i-discuss one by one ang salient points lang po sa atong particular DepEd order na mga protocol. Remind lang na ako po, salient points lang po ang akong i-discuss because I think it's one of the responsibilities of the school as well to read in general po ang the whole length of DepEd Order number 14 series of 2020. So I'll give that responsibility to the respective school heads. So first up, respiratory etiquette and other preventive measures. So ang first na to is measure number 1, practice physical distancing is 1 meter apart at all times. So of course, pag naay mag-ubo, naay mag-speak, naay mga droplets of small liquids na come out sa atong mouth. Mao na bitaw nga mag-physical distancing ta as much as possible at all times. Mao nang bilisan ta mag-besh, kailangan magpalayo sa yuta to prevent COVID. Of course, next, we have measure number 2, frequently clean hands with clean water and soap, doing the proper hand washing and using alcohol-based disinfectants or alcohol. It is important karon nga magsigitag hand washing because we always have the most common contact surface atong matandog, like for example doorknobs, door jambs kanang magunita nato while mag-commute ta. Mo na always ang principles nato either by washing it or sanitizing it with alcohol-based rub or disinfectants. Next, we have proper distancing must always be maintained in sneezing and coughing, using tissue or inner portion of the elbow. That's why we are instructed to cough doing this inner part of the elbow. So dispose used tissue in the garbage bin. This will be further discussed later on by Ma'am Belle Robles. Observe proper use of face mask at all times. So I am in violation actually right now because I'm not pero for the sake of the webinar po, tatanggalin ko po muna, babalik ko na lang later on. So cloth and washable face mask, ear loop mask, indigenous reusable do-it-yourself mask or face shields or handkerchief and such other protective equipment can be used sa mga people na walay symptoms. Pero for those experiencing colds and cough and other health symptoms, kailangan po surgical mask yun ang iliton para po ma-prevent ang paggawa sa mga droplets or any bacteria or viruses paggawa gawas sa ilang mouth or respective disposal of tissue and mask every after use. Of course, the nato i-reuse atong mga mask, dapat atong i-dispose din. Measure number 6 is provide and reiterate relevant information on respiratory etiquette and protective measures. That's what we are doing right now. Ang mga respective district. And of course, the district will then respective the learners and its personnel. And of course, measure 7, ensure access to the following as much as possible. The school should as much as possible provide face mask or any particular disease. So mask dapat as much as possible i-provide na to. Pero katurag yung makaya sa budget. Dili gid nato pod po. Pero what we are saying is as much as possible kung makaya sa MOE po, kailangan po atong i-procure gyud og tarong ang atong mga basic health materials na. Measure number 8, ensure availability of hand soap, hand sanitizers, alcohol-based solutions, and disinfectant. Very important, entrances by doing routine monitoring and replacement. So make sure kung naatay mga with facility, hand washing na ito mga facility, make sure na nanay mga hand soaps, na mga lain-lain classic hand soaps, and of course our alcohol-based solution or disinfectants na sa atong mga nasa atong entrances. Measure number 9, ensure routine cleaning and disinfection on frequently touched surfaces. Tables, doorknobs, desks, school items, and workstations. So, mo na siya mong ginabuhat diri as a division office. We actually spray alcohol or disinfecting solution sa among mga Hello? Hello? Hello, asa ko naputol po. Sorry, my internet connection po is very faulty po. Hello?
Number 8.
Ay, salamat. Number 8 today. Okay, nanap. Padayon na po. Okay. Okay, for measure number 9, ensure the routine cleaning and disinfection frequently. Maputol magad, Ma'am Chief. Thank you, Ma'am Chief. So that was our SGOD Chief. Nag-ensure nga dili maputulot na ng internet. Anyway, moving on forward, ensure routine cleaning and disinfection of frequently touched surfaces and objects. Make sure nga atong sprayan og disinfectants, alcohol, or bleach solution twice a day ang atong tables, doorknobs, desk, school items, and workstation. Ano siya? Measure number 10, make sure na mag-thermal scan ta sa atong mga entrances. So, as I have heard, atong mga schools procure na sa ilang mga thermal scanners. So this will be used before na mosulod sa atong entrances. So may it be guests, may it be parents, may it be children, may it be school personnel, kailangan i-thermal check na to. Or measure number 11, teachers shall conduct a daily rapid assessment in the classroom. Maskin basic lang na pangutanon nato ang atong mga bata kung gilantan ba, giubo, gisipon, makita nato sa ilang mga nawong if they are feeling that way. So ang protocol po nato as much as possible pag naay sick nato ng mga bata or personnel or mga guests, as much as possible dili nato i-admit sulod sa eskwelahan para safe pod ang tanan mga nag-attend during that day. Then measure number 12, implement adjustments to schedule and assignment. So this was already stated in our AWA practices as mandated by the Civil Service Commission and the Central Office. Measure number 13, restrict conduct of physical or face-to-face large gathering. As much as possible, dili pa po, bawal pa po yun karon ang mass gathering. So ang pinaka-kwan lang karon na appropriate o gina-allow is only 10 people. Tapos maximize number of maximum number of distancing po nato 2 to 3 meters per table ta. Only 10 people are allowed in the particular room. So kung mass gatherings, dili siya allowed. Measure number 14, provide and maximize the use of online platforms such as what we are doing right now. Nag-webinar ta, pili ta, wala ta sa balanghay, wala ta sa laing-laing lugar, but we are using the internet para makakondakta sa atong webinar, which do not require physical interactions or congregations for the performance of tasks. Then, limit only travel that is applicable later on pag nanay travel. So, limit travel only to the most critical and essential office functions. Then, devise and implement alternative means of recording and monitoring attendance. So, this pertains to the school heads, mag-monitor tag-attendance sa atong mga personnel. So, kailangan mag-devise o alternative means sa pag-check sa mga attendances. Like, for example, there is a division office, naga-fill up ta Google form or Google Sheets that was being implemented by our HRMO and the regional office nga HRMO. And measure number 17, set a flexible dining policy because as much as possible, pag mag face-to-face na ta, dili pwede nga magbundak o adto tanan sa canteen. Kailangan po na either sa classroom ta magkaon or kung muadto sa canteen, kailangan schedulean ninyo nga si grade 1 sa first 10 minutes grade 1, then grade 2 dayon, grade 3 ana dapat ang atong pag set up sa atong canteen or sa atong dining policy dira as a school. Then measure number 18, ensure the operationalization operationalization of the preventive alert system in schools or PASS for COVID-19. This is from DepEd Memorandum number 15 series of 2020. I think the school heads and the DRR coordinators in the schools are familiar with this particular mechanism. So, i-remind lang namo as part of the school health and nutrition section nga inyong i-ready and dapat magamit ang inyong preventive alert system in schools or PASS for COVID-19. Measures number 19 and 20, strengthen implementation on the TFC memo number 25, minimum standards of social distancing. Then develop contingency and response plan for COVID-19. As well, I am pinging the school heads and the DRR coordinators of the schools for this particular implementation because this is already stated in DepEd Memorandum number 15 series of 2020. So this is a separate topic from the school health and nutrition section sa DRR niyang aspect po. So make sure that you have your contingency plan and response plan for COVID-19 if and whenever, knock on wood, na mahitabo sa inyong skulahan. Then measure number 21, strengthen the implementation of DO10, which is the policy and guidelines on comprehensive WINS program. As you can recall, we released a memo, I think May or June, nga nag-enjoin sa tanan mga schools na to nga as much as possible ang WINS ang focus WINS program ang focus sa Brigada Eskwela. So make sure as much as possible ang tanan nato mga interventions are focused towards hand washing or health-related interventions ang atong buhaton sa atong mga schools. Then measure number 22, strictly enforce na DO13 series of 2017. Guidelines on healthy food and beverage choices. As much as possible po, healthy po ang atong ginakaon or ginapakita dito sa atong canteen because research shows and study shows that a healthy person is least likely to contract kanang adverse or kanang mas worse na effect pag makontract kag COVID-19 because as you can hear on the news, daghay mga asymptomatic na to. Asymptomatic na sila, it's because they have a healthy immune system pero they are still carrying the virus. So as much as possible, you must optimize your health by eating the right kinds of food and of course, exercising and etc. mga health practices na to. Then measure number 23, please strictly enforce the ban on smoking and vaping sa sulod sa atong school premises. Dili dapat yun mag-smoke sa atong school premises. I repeat ha, dili ta mag-smoke. So kung na mga smokers nato ng mga teachers and unsa pa kaha ng mga personnel, please i-enforce yun nga dili mag-smoke because cigarette smoking can predispose one to different respiratory health conditions. We are strictly enforcing against this. Then provide access to brief tobacco intervention and yun na po. Measure number 24, physical arrangements. So make sure po, as you can see on the screen, na ay proper physical arrangement po sa atong mga classrooms. Natay makita mga XX, lang akong i-zoom para for clarity. Ayun. So as you can see sa screen, as you can see on the screen ay mga XX in between sa mga bata. It's because pag mag-physical reporting na ta, dili gyud dapat ta mag-maximize sa atong seats, but rather atong yung space sila accordingly. Using the new furniture, dapat a maximum of 21 learners per room. Ano siya? Okay? So, ensure proper ventilation, dapat naka-open ang windows. So, this was already cascaded to us by the contra-COVID checklist. Dapat naka-open na itong mga windows kay para musulod ang hangin. Then for offices, install temporary barriers between cubicles and tables. Then for classrooms, adhere to the prescribed layout as shown on the screen. Then next, measure number 25, foot bath in entrances. Then toilets with adequate water or soap. Then hand washing stations na to. Dapat functional na siya and usable na siya sa atong schools. Measure number 26, sufficiently provide the following, na mentioned ni earlier, mga basic health materials na to. Then measure number 27, display or distribute IEC materials on health and safety. So atong suggest sa atong contra-COVID checklist, palihog ko ang atong mga school entrances, dapat na yung mga contra-COVID nato nga mga tarpaulins na kung say mga measures nato to prevent COVID-19. So measure number 28, create and operate the common area for accommodating visitors and clients as well as designated areas for risk groups. So this will be discussed later on by Ma'am Lizette Gwendolyn Timore for the third day. Then measure number 29, ensure set up of materials recovery facilities, then ensure availability of ICT infrastructures and facilities. So I will not press on that further because sabotized na siya, understood na. Then measures number 31, 32, and 33, school office, clinic for basic services. This will be discussed by Ma'am Gwendolyn tomorrow. So kanina aspect, measures number 31, 32, and 33. This will be discussed in detail because this is very important. Okay, physical and mental resilience, measure number 34, 34, mental health and psychological support. This was tackled already during day 1. Mo ni siya ang topic ni Ma'am Love and Ma'am Osa. We were able to cascade that particular session para ma-help mo aning particular topic. So, mental health and psychological support. Kailangan nato sila provided as much as possible og mental health and psychosocial support through the following means, like validating, i-count down sila, i-link kung kailangan sila i-refer to other institutions or agencies, kailangan na to i-antagan sila on how to focus on positive activities and so on and so forth. Okay, measure number 34 for schools. The first 5 days that learners are physically present in school shall be devoted to the discussion and facilitation of modules related to MMPSM. So, mo to siya ang gibuhat na to sa atong day 1. And of course, the modules that is being described here are under the DRR coordinator. So, ato lang pong ulatan because a future memorandum will be cascaded puhon-puhon, may it be within this week or next week. So, ulatan lang na to. Basta modules po, igawasay na po sa atong DRR coordinator and to be assisted by our mental health coordinator po. And moving on, measure number 35, engage learners. Pag magkuha na ni siya ha, pag mag face-to-face na, engage learners in at least 60 minutes of daily physical activities. Pwede po sa non-face-to-face ninyo, mag-session po mo, mag-zumba mo. That is very appropriate and that is very timely. And at the same time, dili po board po na itong mga bata. Encourage adults to engage in at least 30 minutes of daily physical activities. Measure number 36 to 37, as much as possible, physical examination for personnel. So, as you heard, it was discussed by Annalyn Sevilla that we have been, I think, allocated with 500 pesos each for the upcoming anniversary, DepEd anniversary, para allocated po for physical examination. So we are going to wait on that. Tanan-tanan po, makadawat po ana para sa atong physical examination. Isa na siya sa atong mga health org initiatives sa atong central office sa DepEd. Then, measure number 38 to 39, provide alternative arrangement to members of the most risk population. Mauna siya, nakabantay tang atong mga district nurses, nagkuha sa atong mga comorbidities, kinsa tong mga buros, kinsa tong mga naay, mga lain-lain condition. It's because this will be used as consideration po sa inyong mga school heads, district supervisors, o sa atong mga division personnel sa ilang arrangements with regards to work. And explore partnerships to provide assistance to members of vulnerable groups. As much as possible po, kung naay kaya ang schools, maka home to home, bitaw nga kuan sa atong mga personnel, atong buhaton because this is very important kay ang dako magud na factor nga magka-contract ng COVID-19 is actually during when we are in public spaces, and that includes po pag mag-commute ta. So it's very hadlok kanang mga tao nga sige ga commute, especially our AAs. So atagi gid na atong mga vitamins, ang atong mga AA, and butangan atagan gid nato pang PPE, and of course sa atong kuan, sa atong mga eskwelahan kung makaya. I'm not saying na inyo nung buhaton, I'm just saying na kung makaya inyong pangitaan way nga mahatid sundo ninyo mga personnel nga mo report. It's because one yun, ang commute yun ang pinakadlock yun when it comes to this particular one situation. Measures number 40 to 41 and 42, dili na ko mo elaborate further because it is dili man din ako siya within my reach or within my jurisdiction, kumbaga. Measure number 43, make sure that mao ni siya ang atong gina-follow nga practices for the availability of emergency kits and PPE. So first up, kung mag-triage ta or mag-screen ta nga naata sa entrances, okay ra gid kayo nga maggamit ra ta og face mask. So katong mga nag-report sa entrances, pwede na mo mag-face mask. Pero as ang mas maayo gyud, face mask o face shield. Ay para kung magstorya, si guest or si kanang gusto mo sulod sa eskwelahan, kung maluwaan ka niya, na mo shield sa imong nawong makasagang ka. Okay, next is for caring for suspected cases of COVID-19 with no aerosol generating procedure. So ang mahitabuan ni, what if naamoy mapasulod ng personnel na naay symptoms? So ang protocol nato is as much as possible dili sila mo adto sa entrances, di ba? O dili sila mo report for that day. Pero kung maka-report sila tapos naka-observe mo na naa sila COVID-19 symptoms like fever, cough, flu, and whatnot, ang protocol maganda to is i-hold sila. That's why we have our isolation area, which will be discussed later on by Ma'am Gwendolyn on day 3. So, ang required na itong PPA for that particular matter na pagka na sila sa sulod sa isolation area or kanang gisulod na sila sa room, naghulat mo sa barangay health worker to fetch that particular person is medical mask, goggles, face shield, gloves, as much as possible, like gown. Okay? So, caring for suspected or confirmed cases with COVID-19, I doubt po na maabot na nila na kaso sa school. It's because as much as ang may tabo mong gudani, once there is symptoms, i-forward na to sa atong nearest barangay health unit or barangay health worker, then sila po mo process ana. So kutob ra kita I think sa pag-isolate sa person, then contact dayon sa atong taga-barangay. So if ever we have the chance to care for that particular mabutang tanan na particular situation, kailangan ta mag-use og goggles, face shield, respirator nga N95 or FFP2, kato ng mga mahalon tag 45 pesos to 80 pesos na siya ng mga ng mga mask, gloves o gown. So, ang atong medical mask, as much as possible, 3-ply na siya. Then, atong goggles, as you can see, goggles or laboratory safety goggles. Ano siya. Then, face shield. Full face shield. Kung eyes ra ang na-cover, ana, eye shield na siya. Di na siya face shield. So, dili ka kasagang 100% na. 50% try mo masagang, ana. Then, measure number 44, observe proper protocol on screening and returning personnel and learners. So this pertains to all returning personnel and learners physically reporting to school shall be screened for COVID-19 symptoms. Mo na atong ginabuhat sa atong entrances. The following should have happened 2 days before or within 14 days on the onset of symptoms with of a confirmed or probable case. Face-to-face contact with a confirmed or probable case within 1 meter or more than 15 minutes, or direct contact with a confirmed case or direct care for a patient with a probable or confirmed COVID-19 disease without using proper PPE. So, kana sila, kung naa sila positive, kay ang mahitabo manggod, pag-report balik sa atong mga personnel, kailangan i-screen manggod na. I-ask nato sa mga basic nato nga kwan, na ba kay upusin po nila na, mga yunana, atong basic COVID symptoms, and kung unsay travel history. Kung gikan na sila sa Davao, dapat gikuan na sila, gi-quarantine na sila, dapat na sila gi-report. Gipa-report diretso. So, muna siya ang atong mga principles. Then, measure number 44, take note po sa atong table as you can see on the screen. So, kung naay, makita na to sa atong table, kung ang particular person is symptomatic or asymptomatic. So, kung with travel exposure siya, kung niya symptomatic, not allowed to physically report. Must consult with care provider. Kung niya kailangan mag-present sila o certificate of quarantine completion. Because tendency is, kung nasa travel history or exposure, kung niya makita na to ang symptoms sa ila, dili sila allowed to physically report sa school. So take note po, lahi itong atong gina-enjoy sa atong contra-COVID checklist. Ang atong gina-encourage sa atong mga school heads, di ba under nakaawa ta karon. So kung naay symptoms, maskin fever lang, ang yun or sultinan dapat si school head nga ipa-awa siya or ipa-work from home until maayo siya. as much as possible. So mao na siya ang atong agreement with regards to that. So kini lahi naman ni siya. Kaya mahitabo man gud ana, ibalik pauli na to siya. Kanya na siya fever. Pag naa siya fever, unya manggawas ng lain nga mga simptomas, he is or she is kailangan muadto na gyud sa barangay health unit. Whereas kung maayo siya, like 1 day later or 3 days later, okay na siya. That is probably not COVID. Mao na ang atong protocol is as much as possible preemptive measures ta. So maskin isa pa lang ka symptoms ang atong makitaan or isa pa lang ka timailan na atong makitaan, ipa-work from home na siya, i-suggest na siya for work from home. Then, kung asymptomatic within 14 days, they are allowed to physically report. Pero dapat mag-present sila o medical certificate issued by the local health authority. So as much as possible, mga DOH na mga DOH accredited na mga local health authorities. So, ano siya. Then, relevant travel, kung walay travel history or walay history of exposure, kung symptomatic siya, or makita na itong mga simptomas, seek medical advice or proper treatment and intervention and issuance of necessary medical certificate prior to physically reporting. So kung fever siya, opera na siya. Pero kung sip-on, kailangan magpa-chest x-ray and magpa-relevant medical laboratory exams ka. Pero not to the point na ay mag-PCR test or mag-rapid test. It's because the PCR test is only ang mag-refer ana is particularly taga-barangay na to or taga city health office or respective health DOH controlled mga health offices. Then, if wala siya travel exposure and wala siya history of exposure rather or travel, then asymptomatic siya, then he or she is allowed to physically report. Pero of course, with our basic health protocols installed, which is the mask, the etc. etc. So kana ang testing protocol, di na ako na-discuss further because like I dili man na ako siya kuan. This is within the scope of the DOH po. So, ang ako lang pong advice is kung unsay akong dili ma-discuss, make sure to read it in scrutiny po on your own time because we are time constrained for the moment po. Then, measure number 45, asymptomatic learners and personnel with relevant travel history of travel and close exposure or contact with individuals known to be COVID-19 positive shall complete 14 days of quarantine from the date of last contact with the confirmed case either at home, in a DepEd facility or referral facility. So katura ang naay katog yung naay positive nga tawag sa ilok. Swab. Kalimot ko pa rin sa concept. Dagan na magigay ko yung na-memorize. So, katurang confirmed na ay swab na positive. So, kinsa na may maka-declare ana, si DOH la ang maka-confirm ana. Because ang swab is controlled po sa atong DOH. Ang rapid test po nato is available siya sa atong mga private institutions, pero ang quad is really siya 100% reliable. It's because ang gina-check po sa atong rapid test is actually the antigen na. So wala pay dili siya confirmatory kumbaga. So mao na ang ilang ginapasihan pag magtali sila cases sa DOH is actually the swab testing. Mao na siya ang confirmatory. Okay. So as per CS, ako rang i-remind po ang atong mga school heads and PSDSS and of course our health personnel po for additional information nila. As per CSC mandate, if you are declared as a positive, suspected, probable for COVID, the first 14 days are not charged to his or her leave credits. Pero dapat naa siya appropriate medical certificate issued by the RHU, CHO, DOH. So dili allowed ang AMO medical certificate. Dapat RHU, CHO, DOH ang nag-issue sa certificate. Pag mo claim mo ani kay kuan man ni siya, murag benefit man ni siya kung benefit na gihatag sa CSC kung if ever you are found to be contracted or ma-PUI-PUM mo tapos i-force mo nga mag home quarantine, dili mo mag-atubili. Kaya ang atong magyong kuanan na, ang atong hunahunaan na, kung di ta mo report, wala tayo sweldo. O nang gihatag ni nga kuan sa CSC, it's because para kung sultian mo nga mo quarantine, mo abide mo siya din. So, then facility reflecting the same has make sure that the facility that is issuing the said certificates dapat nag-reflect siya, undergone siya quarantine and has finished such quarantine measures. So, first 14 days lang po ang ginahatag sa atong civil service mandate. Pero for absences that are 15 days and above, SL shall apply appropriately. Mao na siya ang according sa atong Civil Service Memorandum. So I repeat, first 14 days lang po nga gipatawan siya og judgment from the RHU, CHO, or DOH, which is kung unsay appropriate niya na condition, i-quarantine siya, moran siya ang libre ang first 14 days. Pero for absences which are 15 days and above, SL na po ang atong gamiton or gamiton. So, info lang na daan. So, for personnel who are sickly, suggest or bargain the use of work from home setup in lieu of reporting for work. Because of course, we should be extending extra humanitarian consideration at this time. That's why nga naatay awa. So, kunya, ang ato manggod is we are being preemptive with our approach towards kung kinsay pwede mo report o kinsay dapat mo report sa atong mga respective eskwelahan. So, and of course, that is all. Thank you for listening. I hope that you have learned a lot from my topic. So, ayun po. That was the end of my topic. You can read and get details for this particular topic. Kikuha ni siya tanan sa atong DepEd Order number 14, series of 2020. As I mentioned earlier, salient points lang ang akong kuha sa discussion kay para po ma-accommodate ang atong time frame or time schedule with regards sa conduct sa atong activity. Teka lang. Okay. And I am done. Ayun. So that is officially the end of my presentation. So the time now is 2:30. May 1 hour pa po tayo before we will end with our discussion. So are there any comments, any suggestions? You may write at the chat box while I'm preparing for the next presentation of Ma'am Beljoy Robles. So ano po yung mga comments natin? I will read them. Sorry po na wala. So are there any other questions, comments, suggestions? Feel free to use the chat box po to your advantage. Hello. Alam po. Mute. Okay. So I'm now done with my presentation. I am now giving the floor to Ma'am Beljoy Robles for her topic on Respitiquette, which is respiratory health readiness and basic COVID preventive measures. So once again, our speaker for that particular activity, our session rather, is Beljoy T. Robles, RN, OKD Health Services Division Coordinator. So a round of virtual applause for her, please.
Palakpakan. So at last, my slides are ready. Thank you, Sir Zen. So good afternoon to all. My topic is respiratory hygiene or cough etiquette and COVID-19. So for the past 7 months since the start of COVID-19 spread in December 2019, the government had been urging everyone to practice respiratory hygiene to mitigate the spread of infection. In fact, all forms of media had been advocating for this and are constantly reminding us to wear our masks, to sanitize our hands and other surfaces, and to maintain physical distancing. After a time, we became so accustomed to doing these things that we do it instinctively. We do not give conscious thought to what we are doing and why we are doing these practices. In other words, we have developed a habit. I think this is part of what we call embracing the new normal. Now, if respiratory hygiene practices have become a natural practice in our daily lives, why do we still teach this in school? So can I have this next slide, Sir Zen, please? So why does DepEd Order number 14 say that respiratory hygiene be cascaded to the schools? So I listed down 3 important reasons. Number 1, respiratory hygiene and cough etiquette are important components to protecting ourselves from illness and preventing others from becoming ill. So where before, those who have respiratory illnesses are just the ones wearing the masks, now we all wear it. And we say, my mask protects you and your mask protects me. Number 2, respiratory hygiene and cough etiquette does not only protect us from COVID-19 infection, but also from other respiratory illnesses such as common colds, flu or influenza, pneumonia, and other gastrointestinal disorders like diarrhea if we do not wash our hands, as well as other skin and eye infections. And number 3 reason is that health experts like DOH, the Harvard University, the WHO say that respiratory hygiene and cough etiquette are the best and simplest way to prevent the spread of COVID-19. So next slide, please. So this is the first slide. Now, what I'm going to present to you is the material that you can use. Please go back to the previous slide, Suzanne, the first slide, okay. So the red area there shows how widespread COVID infection is. So if you can see the red area there, that is COVID-19, and it's called a pandemic because it is occurring worldwide. It crosses international boundaries and affecting a very large number of people. So in this particular material, this is supposed to be, or ideally for the learners. So this is short and this is simple, and the slides are illustrated, meaning there are pictures for simple recall and to emphasize to the learners the points that is presented in the slides. Now, we have 5 objectives. And at the end of the discussion, the learners can identify the virus that causes COVID-19 infection, Recognize 3 signs or symptoms of COVID-19 infection. Relate how respiratory infection is spread. And then the 4th, define respiratory hygiene or cough etiquette. And number 5, enumerate the 5 elements of respiratory hygiene or cough etiquette. Now, these 2 terms, respiratory hygiene and cough etiquette, can be interchanged, no? Or you can even say respiratory etiquette, okay, for short. Now, we have our next slide. The next slide says, hello everyone. Today we're going to learn about coronavirus disease and how we can help prevent its spread. As I have said, this is ideally for the learners. So when you cascade this to the schools, you will also say this to them, no? It's like a teacher is telling the learners as a way to introduce the topic. Okay. So by the way, did you know, sir, please go back to the previous slide. After that is the slide. After that, sir, did you know? Okay. Okay. By the way, the previous slide says, what is the virus that is responsible for the coronavirus or COVID-19 infection? Do you know the name of the virus? If you know, can you please type in the chat box the name of the virus that causes COVID-19 infection? So 9, 8, 7, 6, 5, 4, 3, 2, and 1. Okay. So we have answers like SARS-CoV-2. Okay, SARS-CoV. So thank you for your response. So did you know? Did you know? Next slide, please. So the following slides, therefore, contains information in question form. So this would help to draw out a response from the learners. If the learner does not know the answer to the question, he will know at once because the answer is provided. If the learner already knows the answer, then he will be proud of himself for knowing these things. So what are the 4 questions? The first one is, did you know that the virus that causes COVID-19 infection is SARS-CoV-2 virus? What's the meaning of SARS? It's severe, acute respiratory syndrome, coronavirus 2. Okay, the next is, did you know that COVID-19 can spread easily from person to person? And the next, did you know that COVID-19 can spread through sneezing, coughing, or when people interact with each other in close proximity? And the last, did you know that COVID-19 virus spread can be prevented by following specific safety measures? Now, next slide, please. Summarizing the 4 questions, we get this important information. The name of the virus that causes COVID-19 is SARS-CoV-2 virus. The virus can spread through person to person by sneezing, coughing, or being in close contact with infected person. And its spread can be prevented by following specific safety measures. Next slide, please. Yes, COVID-19 spread can be prevented through respiratory hygiene or coughing etiquette. So what is respiratory hygiene or coughing etiquette? They are infection prevention measures to decrease transmission of respiratory illness. So that is the simple definition of respiratory hygiene or coughing etiquette. So next slide, please. This is an introductory slide. And it says, before we learn about the preventive measures, let us check some information about the disease called COVID-19. So in here, this slide introduces COVID-19 as a disease. So another question for you to answer, what is usually the first sign or symptom of coronavirus infection? Or why do we suspect that a person may be infected with the coronavirus? Again, type your answers. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Okay, thank you. I can see that most of you answered fever. Yes, that is correct. And when can we say that there is a fever? When the temperature is 37.5 and above. WHO said that the normal body temperature is 36.5 to 37 degrees centigrade. Okay, thank you for the response. So next slide, please. Most people infected with COVID-19 experience mild fever, so that's the answer, and manage to recover in some time, but it can be more severe for others. So the next slide contains more information. Next slide, please. Others will also experience coughing, sneezing, sore throat, fast breathing, tiredness, and other flu-like symptoms. Next slide. Coronavirus is difficult to cure, and there is still no vaccine available to prevent its spread. Many people had been infected with this disease, and although many have recovered, many have died also. So for the statistics, worldwide, we have 22,111,240, of which 6,484,000 of this is active. In the Philippines, we have reached 169,213 as of last night, no? And then in Caraga, we have now 393 confirmed cases. So the next slide says there, our everyday lives has also been affected by the pandemic. So it is a general notion that we are all affected by the pandemic, and the learners may be able to relate to the situation as presented. So this can be used by the teachers as a springboard for discussion on psychosocial and mental health issues. Next slide, please. So this is one of the changes. Many people have lost their jobs due to closure of factories, businesses, and companies. Some learners whose parents are employed in the private sectors or those who own commercial businesses may have experienced these drawbacks. Next, maintaining physical distance of at least 1 meter away from each other means no more hugging, no more beso-beso, no more handshakes or high fives. This could create a feeling of social alienation, sometimes cautious mistrust or suspicion. We tend to regard most people as having the virus. And children are more vulnerable because they need socialization and interaction with other people aside from family members. The next is stay at home. So to keep safe, we are told to stay home. Hence, we cannot go out anytime and anywhere we want to go, unlike before the pandemic. Another change that occurred or that is happening, some people experience social stigma and discrimination, especially the frontliners, the LSIs, the ROFs. No? LSIs are locally stranded individuals, ROFs are returning overseas Filipino workers, and those who tested positive for COVID-19, and even their families and friends. Okay, and the last one we have, okay, schools are closed. So children are confined at home for a long period. Boredom, lack of in-person contact with classmates, longer screen time, less physical activities may make children more vulnerable to physical, mental, and emotional health issues. So for the next slide, it says there we do not want COVID-19 to stay forever, right? So you tell this to the learners. We want things to go back to normal. So then we have to do our part in order to prevent its further spread and to protect ourselves, our loved ones, and the world. So children love superlative words. They say, I am the best in the whole wide world, or I am so strong, or I am Superman. So we use these words to arouse their interest, to cooperate, no, and do something. Now let us have a look at the steps we need to take to defeat coronavirus. Number one, and the first of the components is avoid close contact with people who are sick, especially those who are suffering from fever, cough, colds, or acute respiratory infection. So if you are the one suffering from any of the symptoms, follow these 4 advices. Number 1, seek consultation with your doctor. Number 2, take your medicines. Number 3, stay home until you are completely cured, and wear masks to prevent the spread of infection to others. Now, some of us may have symptoms, may be experiencing some symptoms now, and we are afraid to go to the hospital for fear that we may get infected, no, with virus in the hospital. Let me just remind you that we have our DepEd doctor. So na si Dr. Anino, and you can just contact your district nurse who will refer your symptoms or your signs to Dr. Anino. So that Dr. Anino can give the needed relief or medicines for your signs and symptoms. The next component is when you are coughing or sneezing, cover your mouth and nose with a flexed elbow. So when you use your hand to cover your mouth when coughing or sneezing, the virus can land on your hands and can be transmitted to things like doorknobs, tables, and other surfaces the people around you are likely to also touch. Okay? So the next slide says, remember, cough and sneeze, elbows please. So this is a rhyme, and rhymes are easier to remember. So remember, cough and sneeze, elbows please. The next is, next slide please. The third component is, if you are using a tissue, discard the used tissue into a closed trash can so that any virus cannot escape into the outside environment. It is always advisable to use a tissue when coughing or sneezing, but due to the fact that tissues are quite expensive, that is why we will just have to use our flex elbow. No, it's not every time that we have tissues with us or that we're bringing tissues. And also handkerchief, the use of handkerchief is not encouraged anymore. No, so it's either tissue or your flexed elbow. The next one is the next slide, sir, please. The fourth is wash your hands often with soap and water for at least 30 seconds, especially after going to the bathroom, before eating, and after coughing or sneezing. If soap and water is not available, use an alcohol-based hand sanitizer. So remember, next slide, germs are not for sharing. So we have two things to remember: cough and sneeze, elbows please, and germs are not for sharing. By the way, do you still remember the steps in proper hand washing? Do we need to review? Can you type in, please, if we need to review now the steps to hand washing? Yes or no? Yes. Yes, yes, ma'am. Okay, so what are the steps to proper hand washing? The OH says there are 7 steps. So step 1, can we all do it? Step 1, wet your hands with water and put soap. Then rub your palms together. Rub together. Then after that, rub the back of each hand. Back of each hand. Then rub both your hands by interlocking your fingers. Like that. Interlock your fingers. Okay. Then the 5th one is rub the back of your fingers. Rub the back of your fingers. And rub the tips of your fingers. Then rub your thumbs. Rub your thumbs. Rub your thumbs. And the ends of your wrist. The ends of the wrist. And then rinse both hands properly with water. So those are the 7 steps to proper hand washing. Okay, so did you get it? Okay, so we will review from time to time, or better yet, when you wash your hands, you do it. Every time you wash your hands, you do the 7 steps so that you will not forget it. Okay. So next slide, please, Suzanne. What was that again? Remember, germs are not for sharing. Okay. Then the last one, or the 5th one, we have do not touch your face. Do not touch your face, especially the eyes, the nose, and the mouth. So we see some signages there or in the Facebook saying, what was that? Follow women, avoid men, follow women. No? So avoid men meaning avoid touching your. M is mouth, E is eyes, and N is nose. So it is estimated that people touch their faces about 23 times per hour. So when you touch your face with dirty and washed hands, germs can take up residence in your mucous membranes, which can lead to an infection. So it is through the eyes, the nose, and the mouth that the virus can enter your body and thus infect you. So the next slide, please. So that's actually the second to the last slide, which says, so are we ready to perform these steps? to drive the coronavirus out of our lives forever? You can do something. Tell your parents, brothers, sisters, and friends. Always remember, cough and sneeze, elbows please. And germs are not for sharing. So the last line is, come now, let us be our own heroes. Let us defeat COVID-19 by not spreading the virus. So that is the end of my slides. I hope that you will enjoy sharing this material to the learners. Thank you all for listening. Keep safe and COVID-free, everyone.
Wow. Okay. Thank you for that, Mom Belle, and that was Mom Belle Joy T. Robles, school nurse for the Department of Education's SGOD Health and Nutrition section. A big round of applause
You're
for Mom Belle.
welcome.
Virtual clap for Mom Belle. Okay, so now let us use the chat box for your comments, suggestions, and sharing of gratitude for the session. We are actually done now with two of our sessions for today. So goal met na tayo. So a lot of participants are reflecting their kinds of gratitude for the session of Ma'am Belle. That was very nicely done, Ma'am Belle. Okay. Alam po ah. So once again, we are day 2 of our webinar series. Hindi po day 1, hindi po day 3, but day 2. So today is August 19, 2020. And we are now done with the session of Ma'am Belle, and at the same time the second session, which was discussed by myself. Show your presentation. Ayun. So with that said, we are now 3:02 p.m. We are actually ahead of schedule today. So we are now proceeding to the next part of the activity, which is the attendance evaluation. So giving you the link for the particular attendance and evaluation. Please see the respective screen, attendance and evaluation proper. The link for day 2 is tinyurl.com iHeartSH day 2. I repeat, tinyurl.com iHeartSH day 2. I will paste the link in the chat box. Para po madali na po i-click sa inyong respective. So ayan po. So ayun, a lot of our comments from our participants. I will read them later on. So reminding everyone to please accomplish their attendance and evaluation, as they will be used as spaces for your online certificates that will be filled on day 3. So once again, our attendance and evaluation is tinyurl.com iHeartSH day 2. For rating purposes, 1 is the highest and 1 is the lowest rather, and 4 is the highest score. I repeat, 1 is the lowest and 4 is the highest. So while you're filling out the evaluation, I'm going to read to you the different comments from our comment section. So Ma'am Miriam Anuncio said that thank you Ma'am Joy and Sir Zen for sharing. We also have Ma'am Teresita Espino saying thanks Zen. We have Ma'am Juliet Nakaituna, who also said, thank you Sir Zenon and Ma'am Belle for sharing your expertise. Mabuhay tayong lahat.
course. Then we also have Ma'am Chona Aquino, who's expressed, thank you, Sir Zen and Ma'am Belle, for the sharing your expertise today. Keep up the good work. Then we have Ma'am Irene Degamon. Thank you, Ma'am Joy, for the information. And Ma'am Juliet expressed one of her learnings from Ma'am Belle's activity through saying cough and sneeze, elbows please. Thank you. Ma'am Eliasa expressed also that thanks Zenon and Miss Belle Joy Robles. Godspeed. So we'll be giving around 5 minutes for you to complete the attendance and evaluation for this particular activity. So the time now is 3:06 p.m. We will end the evaluation at 3:12. So 6 minutes po. So when you are done, kindly, we will be having our short open forum po after the attendance and evaluation. So if you have anything to comment or ask with regards to the particular topics discussed for today, kindly encode your queries at the chat box. Once again, I'm giving the liberty of encoding your questions through the chat box so that you may these questions will be answered by our resource speakers for today. Okay, we still have We still have 2 minutes left for the evaluation. Grabe kayo kinig ka time conscious conduct.
Pero hapit na. Dali ra ka na sa kay.
O gani. Grabe kayo ka time conscious health and nutrition section. Okay, we still have 2 minutes left for the evaluation. We will now then proceed to the day 2 open forum. So if you have any queries and questions, you may use the chat box. Or pwede put mo, express put mo, and you will be allowed to speak and use the microphone for your questions. Dili ko kasulod sa link sa evaluation, sir. It could be a problem with your internet connection ko. Teka, I'll replace the evaluation form. Yes po, there might be a problem with your internet connection, Ma'am Farah. So worry not. So katong mo na yung mga wala dili kayo stable of internet connection. The evaluation and the attendance form will be available for use until 12 midnight. So I'll be giving time before I will close the evaluation for the day. So I will be closing it at 12 midnight later on. So the time now is 3:12 p.m. and we will now proceed to day 2, which is open forum. Day 2 open forum. Okay, before we proceed to that, let me read to you some of the comments in the chat box. We have a lot of clapping emojis right here in the chat box. Maraming salamat po for appreciating the efforts of our speakers. A lot are signifying also for their accomplishment with the evaluation. And Ma'am Edita Ceniza expressed her gratitude for Ma'am Belle and Sir Zenon. Yours truly. So ayun po. Are there any questions po with regards to the presentations that was done? I am inviting everyone to please ask anything with regards to the basic policies. Kung may apprehension kayo, may questions kayo, wild reactions, or whatnot, the floor is yours for the taking po. And if there are any questions with regards to respiratory etiquette and the basic COVID-19 information, we also have Ma'am Belle to answer your significant questions.
Hi, Dad.
Okay, and that's. Are there any other questions?
Okay, I was talking to our school's division superintendent, so anyway, here is a question from Maria Teresa Dasmariñas Serrano. So the question states that, hello Sir Zenon, are we going to have a district rollout of this webinar to our respective districts? If yes, how many days? For that particular koan, ma'am, I think that is within the discretion of the district and the district supervisor. So pwede mo as district OKD coordinators, mo-direct or mag-ask or mag-recommend sa inyong district supervisors kung when mo mag-conduct sa inyong respective webinar. And the resources or the materials that will be used for the conduct of the webinar will be provided to you after the conduct. Paagi na mo through advisory para inyo dayong ma-download or pwede sa among ipang-send sa inyong functional email ad nagipang forward katong nagpa-registration to me. So among i-forward ang mga resources material dito sa inyo. So kung as to the conduct of how many days, again, that is within your discretion po kung how many days. Pero ang sa amin po kasi, or pwede din na lang kung Tagalog. Ang sa amo amang good is that we spend this particular set of activities for 3 days. It's because we are also considering the the kanang bitong attention span sa facilitator. As you can see, more medyo strict me with regards sa 2 hours, 30 minutes, ganon. Because when you stay to the screen too long, it becomes very mundane. Sometimes eye straining siya. Maunang ispan na mo 3 days kunya at maximum 2 hours or 3 hours at most per day. So, na siya. So, I hope that you would consider that as well pag mag-conduct mo sa inyong respective activities. Tanggal sa akong face mask para clear ang voice. Next is it okay for a COVID survivor to donate blood? I think as long as you have been cleared by the respective agency responsible, which is DOH, you can donate for, I think murag ginapang pangitaan ganin na siya sa Cebu, yung mga nagdo-donate ng plasma. So it is encouraged actually, pero that you still have to like undergo a lot of I think a battery of tests para to ensure that you are really COVID negative or COVID recovered rather. So, are there any other questions po? Okay, Ma'am Jeanette. You're welcome po. So, thanks for the idea and consideration. Maria Teresa Dasmariñas Serrano, thanks, Sir Zen. So, any other questions from the group? Wala na po. Okay, and now we are done with our day 2 of our iHeart School Health Activity Webinar Series. Woo! So 2 days na. 2 days tapos na po ang ating webinar series. And the 3rd day is tomorrow, which is iHeart School Health Inside the Clinic, a day in the life of a school clinic in charge. So very, very OCD yung topic natin for tomorrow. It is because it is really based on the O14 series of 2020, which is the designation and responsibilities of school clinic in charge and mandatory allocation of rooms for specific use. So, brief highlight, siguro, a quick lang ana, isolation room, clinics, and guidance office. So, muna siya ang entails atong DepEd Order number 14. It will be detailed further by none other than one of our school nurses in the SGOD Health and Nutrition section, which is Ma'am Lizette Gwendolyn Timore. So tomorrow will be our last day. And of course, tomorrow will also be, you will be provided with the information on how to get your electronic certificates. That is DepEd issued po na electronic certificates. So that's it. So I guess we're now done with
task ko. Oh, slide. So ayun, I think we are now done with officially with day 2. We in behalf of Dr. Eladio B. Anino III and the rest of the School Health and Nutrition section, we would like to express our deepest and sincerest thanks for your attendance in this activity. We hope that we continue to support our webinar through attending the third day of the iHeart School Health webinar series. So katong mga wala pa naka-evaluate, please evaluate po before later on at 12 midnight. Would like to thank once again thank you for attending this activity and have safe and COVID-free and at the same time good health practice in all of your respective schools and districts, and God bless you all. Stay safe po, everyone. So ayun, naputol po. Maraming salamat po sa pag-attend to the School Health and Nutrition section. Thank you for attending as well. Thank you everyone. Ma'am Rochelle, Ma'am Annalisa Baning, Ma'am Arlene Lubang, sa isang talagang mo abang na po. Ay ma'am, nag-webinar. Irene Degamon, Annabel Son, Arlen Lubang, Arlene Pagara, Charito Bermejo, Chana Kinuday si Pero Elias sa Magtante, ma'am, thank you. Ma'am Esther, thank you. Ma'am Geraldine Dupor, thank
Welcome,
you.
sir.
Jeffrey Acerto, salamat po. Ma'am Julia, thank you for attending. Juliet. Ma'am Juliet's, dalawa. Tapos, and the rest of the people who are here, thank you so much for attending. Have a safe one. Be safe and stay safe. Stay COVID-free.